Welcome to Future Focus Now. It's important during these times that we focus on healthy living. Our guest tonight will help us do just that. Dr. Karen Thompson-Williams is a board-certified family medicine physician with over 20 years of experience in community medicine, urgent care, and college medicine. She joined WSSU as the Director of Student Health Services on July 1, holds a BS in biology from West Salem State University, a Doctor of Medicine degree from East Carolina University Brody School of Medicine. As a certified health educator trainer by the National Association of Student Personnel Administrators, she looks forward to growing the university's peer health educator organization to promote healthy choices and practices among the student body. She's an advocate of healthy RAMs for life. As a RAM, class of 1987, she's happy to return to her hometown and alma mater. Been married to her husband, James, for 23 years. They have one daughter in college. Dr. Cherry Brown Griffin. Dr. Cherry Brown Griffin is an assistant professor in the Department of Psychological Sciences. She holds a BA in psychology from the University of North Carolina, Chapel Hill, a master's degree, and a PhD in school psychology from the University of South Carolina. Dr. Griffin's research program examines cultural and contextual factors that contribute to positive youth development with a specific focus on African-American adolescents. More specifically, her research seeks to integrate principles from multiple disciplines, school psychology, developmental psychology, and education to explain Americans' youth experiences related to race, process, and the consequences these experiences have for educational, psychological, and health outcomes. The work expands areas: racial identity, racial socialization, racial discrimination, racial climate, school engagement, and academic achievement outcomes. Dr. Griffin is also committed translating her research into practice, including the development of culturally specific interventions and prevention programming. She is the director of the Minority Academic Achievement Development Lab, where she and her students examine contextual influences on the development of Black youth. Dr. Terry Tilford. Dr. Terry Tilford is an accomplished licensed professional counselor. She served as the Director of Counseling Services at WSSU since November 2019. She has over 30 years of mental health experience, where she has provided services addressing many mental health topics for various age groups and culturally diverse clients. She has served as a program director, associate professor, clinical supervisor, owner of a private practice which she led with her daughter, who's also a mental health counselor. Dr. Tilford holds master's and doctorate degrees in counseling education and has taught over 15 years in various graduate counseling programs to children, Chancellor and Charles. She's a woman of faith and a member of Alpha Kappa Alpha Sorority Incorporated. Thank you for joining me and being here with me tonight. I am so delighted to have the three of you with me tonight. I feel like I'm home. I feel like I'm back on campus with the amazing work and the amazing things that you do. Welcome to Future Focus Now.
Thank you. My pleasure.
Yeah, I'm excited to have you. Now, that was a mouthful in terms of all of that introduction. I see all the amazing things that you're doing, and we'll get into some of that a little bit later. But one of the things that we look at, for example, Dr. Williams, you're Director of Student Health Services. What is that? Tell our listeners what that is. What does that encompass? I mean, what do you do? What is your role at the university?
Thank you, Chancellor. We are the health services for the student body. So if a student is ill, if they are in need of medical attention or care, they can come to us. We are focused on providing general medical care, much like a primary care doctor's office, general care, reproductive health care, screening, testing, HIV screening as well. And we can provide referrals and consultations. We have a laboratory here for testing. And so we are available to meet the healthcare needs of the student body. And that is what we do here at the health center.
Yeah, and more so than ever before. I mean, we talk about health services. It seems like they're more needed today than ever before. You started recently, you came in, I'm sure you had a vision. I mean, what has been your experience since you've been on campus?
Well, I tell you what, Chancellor, I walked into an amazing plan that had been already designed and implemented in regards to the pandemic and in response to COVID-19. Having come from a university, much like what had already happened here on campus, I was aware of some of the challenges and concerns that students would have, parents would have, faculty and staff as well. But there was a well thought out plan in place, which was, I will say, a bit of a relief, but also not surprising because I'm a Ram and I know how Rams do. But at the same time, I found everyone really supportive and helpful as we navigated putting the pieces, the final pieces in place to help take care of the students here on campus.
Yeah, well, we're certainly glad that you're here. We need your services. We need your leadership more so than ever before. Dr. Griffin, you're in the Department of Psychological Sciences, and full disclosure, I have a faculty appointment in your department. Did you
Yes.
know that?
Yes, I did know that.
No, that's pretty cool. I mean, I said, I'm glad that you're here. You have been at the university. When did you
Since
start?
2016.
In 2016, you've been here. You have an amazing research portfolio. You do a lot of things. You're a faculty member in our CSIMS Center. You work with students. Tell us a little bit about your time here, what you do. Tell our listeners about your role at Winston-Salem State University.
Sure. Thank you, Chancellor. So I like to identify as a teacher, scholar, activist. So I feel like those identities sort of kind of summarize what I do on a daily basis. So engaging with students in the psychology department, as well as those outside the department, it's really important that I engage in mentoring, especially around issues related to social justice, which we know at this time, and we probably will get to perhaps much later in the conversation, is certainly of the utmost importance. And so I love talking to the students about how they can get engaged with undergraduate research experiences in my lab that you mentioned, the Minority Academic Achievement and Development Lab. And so I like to not only bring my scholarship that looks at these different issues that impact Black children and adolescents in the classroom, but then I also like to take it to the community and think about, well, how can we go beyond the ivory tower? How can what we do actually have more than impact on our community campus, but then also extending it out to the broader community and thinking about how we can change lives there. And so getting students also involved in that community engagement as well is important for me.
Yeah, you are among a growing list of individuals at Winston-Salem State who have taken the classroom into the laboratory and getting involved in research. I'm interested, talk a little bit about that philosophy, why that's important and why you do that.
Well, I think for me, I think about my own personal journey and the importance of mentorship. For me, when I was an undergraduate and having those opportunities to be exposed to scholarship, the different ways that you can do research, my professors in my undergrad, particularly one professor I'm thinking of at the moment, Dr. Shauna Cooper, she was integral in even my understanding of how science is developed and what impact it can have on the community. And so for me, it's always been about not just working in a silo. How can I bring students and make meaningful impact in terms of mentorship? How can I introduce them to ways to generate questions and how those questions then can in turn be meaningful, impactful for the community. So for me, it's really just about impacting lives, both those undergraduate students and as well, hopefully in conjunction, the community.
Yeah, and why is it important to publish?
Oh, I think it's important for a number of reasons. I think it gives credibility to the work. So I think that there's a certain level of credibility that is seen with empiricism, but I do believe that it's important to go beyond that. And so that's why I do try to engage in both these efforts to publish in scholarly journals and teach students how to engage in academic writing, teach them how to, again, generate these research questions and test them out, develop these hypotheses, and that we communicate and disseminate these findings to each other. And so I think it's important to then, when you have that science developed, you can then think about the implications of it for those that you might help. And then once you sort of have that established, I think it's then very critical then, like I keep mentioning, to go beyond the academy and to engage with the community and have that public impact or engagement as well.
Yeah, I mean, thank you so much for that. And thank you for what you do in the psychology department, your publication. I'll get back to it. I saw a new publication that came out recently. We'll get a chance to talk about that later. Dr. Tilford, the counseling services at WSSU or counseling services on a college campus, talk to us about that.
Yeah, so thank you, Chancellor Robinson, for the opportunity to talk about that today. There's so many changes going on across the country, just in colleges in general, so many needs. And as you mentioned, when you started out the pandemic, a lot of the racial tension. And there's also another population of students, and those are students who are seniors in high school. We're seniors last year, and all of those experiences that they missed their senior year of high school, they have great expectations in coming to college this fall, and just things that they've lost by missing out some of the great activities such as prom and athletics throughout that year. So they're just really hopeful and excited. And so as a counseling team at Winston-Salem State, we love our students. We want to support them in their efforts and their success at Winston-Salem State. And so being intentional about helping them along in their journey of being well, helping them to integrate and be comfortable in their setting. Research shows that new students, there's a lot of psychosocial adjustment, so getting adjusted. And so those experiences of anxiety, those experiences of stress, and helping them to cope, to adjust, make new friends, get along with their roommate, engage with their faculty member, be comfortable and moving around campus. All those things are really, really important. And so we hope and we embrace that and try to reach out and support the students around campus to do that. And I think that's true around the country. So along with the typical research-based needs of students, there's also the issues of the pandemic, the racial tension, the election that's coming up, and just the seniors that have missed and onboarded this fall at Winston-Salem State.
Yeah. What have you learned, or either one of you at this point, in terms of this question about the shift that has happened in terms of the utilization of psychological services on campus over a period of time? I've been in this business for a long time, and at the beginning of this, we didn't see that students were utilizing those services early on, say 20, 30, 40 years ago. We've seen a shift in that, where students are using those services more and more. I'm wondering, have you seen that? And if you have any thoughts in terms of why that shift is occurring?
Yeah, I would say on some of the research that has taken place, the definition of accessing mental health is more embraced. I think in some ways in the African American community, there is still an element of taboo. That's something that you don't do, that you can just pray about it, pray it away. You don't necessarily need to reach out and get help. But I would say for the most part, students are reaching out more. In my 30 years of working in higher education, more students are pursuing mental health support services. I think the other thing that research shows is the definition of a crisis and the definition of mental health. And I think individuals are learning how to define when they can practice self-care and learn how to work through an issue, or when they actually need to step in a counseling center office and get either the psychiatric services that we provide or the counseling services that we provide in the counseling center. So just overall understanding definitions and embracing just the experience are some of the new changes that have taken place over the years since I've been in higher ed.
Yeah, and I see you nodding, Dr. Griffin. Have you noticed similar kinds of situations as well?
Well, that was such a interesting question, Chancellor. It made me think of some research that my student who just graduated this past May, Cedrina Lisenby, who completed her honors thesis research within our departmental honors program, looking at perceptions of utilization of the counseling center, willingness to seek out mental health support. And so she looked at a lot of different social identity variables like religiosity. She wanted to kind of better understand whether or not, if you were more religious, would you be either more willing or have more reservations about seeking out mental health support. She looked at cultural mistrust, as well as racial identity, and also perceived stigmatization. So thinking about what you just talked about, Dr. Tilford, with some of that stigma that's associated with seeking help for mental health concerns. And so she collected data from students around our campus, which I think really was a great study that she did, because it addressed some of the limitations in the literature, because a lot of this work hasn't looked at Black students on HBCU campuses. Are they utilizing these supports that are available to them? And so what she found was that there was this awareness of the counseling center, and that students may use these services, but that we need to maybe think about ways that we can even increase their level of awareness with these supports. And I can imagine now, thinking about this transition back to campus in the midst of this Black Lives Matter movement and in the midst of the COVID-19 pandemic, that students are not only needing the support, but I think there's been a lot of dialogue on social media about the need to practice self-care. How can you then go beyond that and then seek the professional help that you need? So I think that there has been more open conversation and more dialogue amongst this generation of students around how they need to be seeking these supports, because everything necessarily can't be fixed through religiosity, for example.
Right. Yeah. No, I mean, I think that's a great perspective in terms of looking at that as this whole segment is about self-care, about health. And what I've noticed over the past, decade or so, or even longer, is that when we think about being healthy, now we look at it from a holistic perspective. Years ago, when I first got into psychology, when we thought about being healthy, it was just, not looking at that side of the equation, but now from a more holistic, spiritual, physical, mental, emotional, and all the factors that go into that. I'm wondering, Dr. Williams, in terms of a director of a student health services, is that what you're seeing and experiencing and hope to promote?
Absolutely. I do think it's important that we normalize mental health, that students are comfortable seeking services, that we have programming available.
I like that. I'm not aware of that term, but I like that. Normalizing mental health.
Normalizing mental health.
I like that perspective.
Mental illness, if you will, because I think it's important that students feel comfortable seeking help on a campus. And I think each campus has its own culture and its own, basically culture that helps to set the tone. And I think when administrations invest and provide resources to help and support programming, whether it's mental health first aid, for instance, and creating ambassadors on campus. And I know Dr. Tilford has an excellent program that she's rolling out soon in that regard, so that students, faculty, and staff are all engaged in all levels in supporting students and know how to support students. Because we definitely have seen in the past decade an increase in students who are seeking services. Primarily anxiety and depression is what we see, but there are other mental health diagnoses that we see as well. But nod to the student counseling centers and mental health professionals, because I think they have kind of made it accessible for students with telehealth. And, long before the pandemic, students would come into the student health center and indicate that, I just got off of HIPAA compliant Zoom basically with my mental health counselor or my psychiatrist or psychologist. And so I think making sure that it's accessible and it is accepted on the campus, I think is very important.
Take us through some of the services, Dr. Williams. A student or faculty member or anyone on campus, prescription drugs. Can I get prescriptions at the?
Yes, absolutely. At the Wellness Center, we have a pharmacy here. It's open Monday through Friday, 8 a.m. to 5 p.m. Dr. Wayne Smith is our pharmacist, and faculty can access and purchase over-the-counter medications. So if you're looking for vitamin C or vitamin D or other over-the-counter medications, you can obtain that here. And of course, it's a convenient service for our students. Having a pharmacy on campus is very critical to making sure students follow through with treatment plans. They can, right after they see us, they can go just around the corner in the next corridor and see the pharmacist and have those prescriptions filled in a timely manner. We do encourage students to consider the Student Health or Student Blue, which is the UNC system health insurance plan for students, because there's no copay and no deductibles. However, if students have insurance, of course, we're encouraging them to bring their banner ID when they come for services, as well as their insurance cards and copays, and we will be happy to see them. And during the pandemic, of course, we are seeing students by appointment only, but we're able to accommodate students usually same day.
Yeah. Can I get my flu shot?
Yes, you can come and get your flu shot, and we encourage you to do so. We are also testing for COVID-19 for students who come in with symptoms and concerns. The American College Health Association very early on recommended at the very least student health centers should be able to provide testing for symptomatic, that is students who have symptoms for COVID-19. And so that is something we have available to students, and testing results are coming in fairly quickly, usually a 1 to 2 day turnaround, which of course, that has been a concern during this pandemic, is how long will it take for results to come back so that you can adequately manage and contain the illness and stop the spread. And so we do offer those services, but we're still offering our non-COVID services as well. As I mentioned, general medical care, healthcare, minor injuries, upset stomachs. And one of the things that's important, I think, for students to keep in mind, and certainly we have it in our mind when we engage with students, is we understand that they maybe for the first time are navigating healthcare on their own. So we want to make it something that they're comfortable doing, and it's accessible. We have RAMQ where they can actually schedule appointments online. There are a few select appointments available online that students can go online and make an appointment, and we want it to be convenient. We want them to know that we are a confidential resource on campus and that we are non-judgmental. That is, we're going to take care of you. You can come to us, talk to us, let us know what you need, and we'll do our best to take care of you.
Yeah, and we can't do this. I'm sure you can't do this, the three of you, in terms of the spaces in which you operate. You can't do it alone. So how is it that we take these services and try to expand them and bring other people into the fold to assist in some of these ways of helping students? I heard something about telemedicine, teletherapy. Tell me about that and how that's utilized.
Yes, I'll share a couple things. First of all, with telecounseling, it's a platform that we use, Zoom for Healthcare. It's a HIPAA compliant platform. And on our website, students can scan a QR code or go through a hyperlink and book an appointment. And with that, we provide confidential, non-judgmental. I love what Dr. Williams stated about the health services. We are the same. We're sworn to confidentiality, meaning that When a student needs to see us and talk about any topic, and we have helped students in a variety of topics in a very non-judgmental way. And so students can access us in the Counseling Center through our telehealth platform that was funded through a grant from the state of North Carolina. We're really excited about that. So it's Zoom for Healthcare, which is very different than Zoom that's used in the classroom. And the second, we were funded for a behavioral health grant to do mental health first aid training and suicide prevention training. So once that grant is fully signed off on, beginning in the month of September, we're going to be providing mental health training and suicide prevention training by a trained professional who has an expertise in higher ed. And there will be sessions available through a Zoom room for faculty, staff, and administrators to come and be a part of that training and be mental health first aid champions, so that when they meet a student and that student is crying, they will know what to say, know what to do. If a student is saying they feel suicidal, they'll know what to say and know what to do, and won't feel as though they're disempowered or not sure or feeling uncomfortable. And creating, really, from the counseling perspective, partnerships all around campus to put our arms around our students on campus, and at times be helpful to our colleagues on campus as well.
I mean, that's really great. That's powerful. And thank you for sharing that. That's great information. I want to take us through in this segment, looking at groups of individuals and how we think the pandemic is affecting them, and how the pandemic may be creating stress in their lives. And let's take them as a group. So we have students who are returning to campus, and we know students are affected, but we also know parents are affected. We also know that sometimes students have children. So I want to get into in a quick segment around children, and how do we feel or think the pandemic is affecting them. I know, Dr. Griffin, school psychologist, you've been in this space for a while. Take us through some of your thoughts around that. I had a great conversation with my daughter earlier today about how is it that she's preparing my granddaughter, who is 5, to deal with this pandemic. Talk a little bit about children and what you think is happening to them.
Sure, great question, Chancellor. So I think it really varies based on level of cognitive development, of course, which is associated with age. And so when we think about younger children, younger children such as, children who are 1 or 2, 3, they may begin to understand and see changes. Like, I don't see grandma as much. I'm not going to church. That 3-year-old may say, oh, I miss going to church. Or again, notice that 2-year-old may be calling for grandma. And not understanding why they can't see certain family members, why they can't go to that favorite restaurant. And so it is a bit challenging to be able to explain to them this idea of social distancing, right? And why we can't go to certain spaces, or even if we do go to certain spaces, why we have to wear this mask. Right. And so I think it's important to have very clear, developmentally appropriate conversations around why things are the way that they are at this current time. And so what that can look like with the younger child, perhaps might be, telling them there are some people that are not feeling well. Our family is healthy, your mom is healthy, your grandma is healthy, for example, but there are some other people who may not be feeling well. And so to protect each other, we want to make sure that they get better and that we work together to protect each other. And so this is why we wear our masks. So we don't want to spread germs to other people. And of course, as they get older, you can think about, talking about COVID-19 more directly and the virus, and communicating to them the importance of social distancing also through modeling. So especially with our teenagers, when we think about that period of adolescence, where they're beginning to get a lot of autonomy, they have that driver's license. So they can go out and they can drive and they can do things. And so you really have to leave it up to them to be able to trust them to make wise decisions when they're going out. And then they too, of course, have these questions like, well, why can't I go hang out with friends? They don't have any symptoms. They're not showing any symptoms. They're not sick. And so having those conversations about, well, this is what the science says, and this is what the Centers for Disease Control says, and having, again, really those direct sort of guidelines laying out for them, because developmentally they're able to understand more so what that means and the significance of it.
Yeah, I'm gonna ask this question and cross developmental periods, but I think it's consistent. One of the things that we talk about, particularly when we had the K through 12 discussion and around education, virtual education, what folks oftentimes talk about that's missing is that emotional socialization development that comes with being in a classroom and being together. And that's the same thing that I hear with K through 12. But if we look at what's happening on our college campuses, so much of being on a college campus is getting involved, being engaged, having that kind of experience. That too is a part of that socialization process. I'm wondering if you have thoughts on what we can do to simulate that and how we can deal with that issue, because I think that's really important.
It is definitely critical. When we think about in psychology, and I know you're, of course, you're familiar with this, Chancellor Robinson, Maslow's hierarchy of needs, right? And one of, beyond these basic physical needs, like having access to food and water, we have basic needs that centered around sense of safety and psychological belonging. So being a part of a collective and socializing. And so I think that, of course, for all of us, these are unprecedented times. And so I think that we really have to be creative. It's a time where we can begin to reimagine and maybe probably change the language. I know sometimes when working and talking with students, I like to say, well, we're physical distancing, but not social distancing. And so getting them to understand that, hey, we have to have these physical boundaries, right? Because this is what the science says that we should be doing to help keep each other safe. But we can still be social in ways that are creative. And so thinking about social media platforms, Zoom. I've known some younger kids to have tea parties over Zoom. And so they have, all the children dress up and they have their little table there and, their tea. And they're able to kind of emulate, of course, wishing it could be, face to face, but they're able to sort of emulate that feel of, hey, I see my friend, we're doing something social. It's not necessarily education based, or we're not going over numbers and letters, but this is a social event that's trying to sort of build some community. So I think we have to really kind of reimagine what it looks like during these times until we get past these phases, but then also being willing to understand and ask questions about how our children feel, knowing that children are humans too. And so we can't just assume that because they're kids, that they don't have these emotions and feelings associated with the pandemic that they may not be able to articulate. So when you see them acting out, it may be because I'm tired of being at home, I'm bored. I want to go out and see my friends. I wish I could go play, but they can't necessarily articulate that. And so they might be throwing toys around on the ground. Right. And so being able to have those, again, conversations with them, I think is important.
Yeah, and so one of the things that we see, and I think some of the problems that we've seen on college campuses, students coming back really with this almost insatiable need to congregate and to be together. Dr. Tilford, I mean, how do we help them manage this, and how do we create opportunities for them to be together?
Mm-hmm. I love what she just said. Instead of thinking about social distancing, change the verbiage around that. UREC has done an incredible job of creating opportunities to engage students where they can socialize using the Zoom platform. I think there's games and activities where they can stay connected. I personally have shared movies online and done games online. So just being intentional of being safe, but staying connected and finding unique ways and staying connected, I think is really important. And I think that smaller groups where individuals are practicing safe social distancing or physical distancing, where there's a small group of 3 to 5 people, because sometimes I know even myself as a mental health professional, I needed to spend time with my ride or die friends and drove to Michigan, and I knew they were practicing safely with COVID. And I took time, drove to Michigan, and I had that special time with my friends, small group. And I think with our students at Winston-Salem, when there can be small communities and individuals are making good choices, I think that's really important too.
Yeah. Well, and great. I mean, we have to figure out how to do this. I think we are. And I think that, what I've seen is our students come and they're prepared to be creative and to be innovative. And that's what I like about college population and what I like about the students here. I want to take us through because I want to get to some ways in which we can help. But let me take us through a couple stressors, and I want to get you guys to respond to this. New stressors that came up, in my opinion, during the pandemic. So issues around disparities in terms of health disparities, for example. What I've said all along is nothing new, but because of the pandemic, we've now begun to shine a bright light on disparities, health disparities in this country. Issues that we've talked about that I want to spend just a moment on, issues of race. That we're seeing that are beginning to pop up across the country because of all the stuff that we're seeing. I just had a new case yesterday, which is really interesting, with a young man getting shot. And it's interesting that his father at one point was at Winston-Salem State University. So it hits home. So it becomes real when it hits home. And I want to, particularly Dr. Griffin, to get you in this space because that's what you do in terms of helping folks manage that. And here's a question I have for you, and each one of you can kind of jump in on this because I'm interested in your perspective on this. I read an article over the weekend this was in Rolling Stone magazine, and it was an interview with Ayanna Pressley. And here's a question that I've been struggling with. And the question to her was question that she asked was, how do we handle the onslaught of images of Black men being choked, brutalized, surveyed, profiled, policed, lynched, murdered, and find spaces to promote our humanity and our healing and our joy? I mean, we have to get to that point what gets us there, Dr. Griffin, based upon your work?
That's a great question, Chancellor. So I like to encourage students when I talk with them and we have these discussions in the classroom. Unfortunately, it's been way too many of these events where Black people have been murdered as a result of state-sanctioned violence since I've been here in 2016. And so it's been a frequent conversation where students are trying to understand, how can I cope? And I like to encourage students that it's a thin line between, of course, wanting to be informed, needing to be informed and being part of the resistance, but understanding that you also don't have to consume everything. And so I talk to them about, you don't have to watch that video. You don't have to watch that Black body being murdered or gunned down. Protect your peace, right? Protect your space. You know your own individual capacity to be able to handle such images. And so I think sometimes, especially again, of course, with social media and these things go viral, sometimes you don't even have to click on it. It might just start playing on its own. But then teaching them to watch what they take in, because you can't pour from an empty cup. And so if you want to mobilize, if you want to advocate, if you want to be a part of the resistance, you also have to be able to have the mental capacity and space to be there. I think it's also important at the same time to know that you can be a champion in these issues and be a part of the resistance and also experience joy. And that joy is resistance. So that in spite of, right, these things that are happening to us, being murdered, all of these disparities, economic disparities, living in communities with food deserts, disparities in education outcomes, that we can still find happiness in things that we enjoy. It's okay to have a hobby. Sometimes people feel guilty when there are things going on around you that are unjust, and that understanding that a part of, again, being able to engage with this work consistently is taking care of yourself. And you do have to prioritize that so that you can get back out there and fight and use it as a way to cope. Find the things that you are interested in and continue with that. And so it doesn't have to be an or, it's really an and. Take care of yourself, protect your headspace, and then continue with the resistance, continue in the movement and get engaged to try to do what you can to rectify these systems.
I like that. I like that. I'm wondering, Dr. Tilford, in terms of your work as students are coming in and you talking to students and hearing from students, if you have seen that this is a lens that folks have been looking more through lately, or I'm wondering your thoughts in terms of that. I know we're just getting back. You probably don't have a large sample size at this point. Talk to me a little bit about that.
Absolutely. It is an ongoing issue that they're processing and have processed a lot this summer. Students were reaching out to us that have went away, came back, or even connecting with partly the athletic staff. They reached out to us this summer, had new students onboarding, and are looking through these experiences with that lens and really struggling and trying to figure out a way to process all the information that they are engaging in. And like she just said, one of the things that we really emphasize is being intentional about self-care. You have to be intentional about caring for yourself, and came up with an acronym around self-care to help students have a resource in the Instagrams that were taking place this summer, empowering them with information of how to take care of themselves and their mental health. And one being creative, creating a new normal and being intentional about their social media space. They don't have to watch, they don't have to see everything, and guard their headspace and making sure that they're making different choices and new normal choices about what they're viewing. And then attitude, choosing the right attitude. Focus on being positive and thinking positive, speaking positive. And although the media really emphasizes a lot of negative, when they move away from that and spend energy and time around other things, from reading, engaging with other people, how can we be proactive and be safe ourselves to advocate and deal with some of the things that is going on in the country? In relationships, choosing friends that are positive and want to advocate, but really in a very positive way. What can we do in a united front to deal with some of the social injustices and some of the COVID issues that we're experiencing? And then the other part, the last part of self-care, is exercise and eating. And sometimes those are things that they can share with each other to take care of themselves. But overall, be intentional about self-care so that everything that we're dealing with is more manageable and that they stay well from a mental health perspective.
Okay, great. One of the things, Dr. Williams, I'm wondering, as Director of Student Health Services, when a student will come in and they have, physical manifestations that may be related to some psychological issue, particularly I'm thinking more in this pandemic around grief. I can imagine there's so many of our students who come from communities or even come from families that they may have lost a loved one to COVID or some other issues, and we know how grief manifests itself. I'm wondering how as a service, we make those kinds of assessments. And maybe you do more holistic. I'll just ask the question in terms of determining, student comes in presenting with something, clearly it may be a psychological issue.
Thank you for that question, Chancellor. One of the things we do with every student that we see is assess their mental health by conducting PQ9 screening, no matter what they come in for. And when we recognize there are students who may need to speak with a counselor, then certainly we make sure to connect them with the Student Counseling Center services. And also in regards to just addressing disparities, we want to make sure that we are accessible to all students. And so when students come in and maybe have challenges, if they have, for instance, commercial health insurance from their parents, and the copay is, exorbitant, and they're unable to pay it. We try and make sure that we can direct them or support them through RAM relief, emergency funding, and we are also exploring having grants to help support when students on occasion may have a need to have financial support in regards to meeting that copay so that they can see us when they need to see us.
Yeah. And I can also imagine during these times when students are coming back, first and foremost, COVID-19 is going to be on their mind. So student comes to seeking services, and they're requesting, I'm sure they would be requesting testing. Take us through what happens when a student comes and they're tested, and then take us through if a person is positive, what happens?
Okay, so for our students, every student is seen primarily by appointment. And so when they call and express concerns that maybe they're exhibiting symptoms of COVID-19, or they're concerned they may be exposed to someone with COVID-19, then we bring them in for an appointment and evaluate them, much like a regular office visit. Of course, we are the healthcare staff have adequate PPE or personal protective equipment on when we do so, and we would conduct a test. We also conduct flu test screenings as well as a COVID-19 screening. We advise students with symptoms of COVID-19, much like your email that you sent out last week with the screening, attachment C, which is part of our reopening plan. Everyone should be screening every single day and asking themselves, do I have any of these symptoms? The students have these great safety kits and they're able to check their temperatures. But when they come in and they have symptoms, we're asking them to quarantine, and we do have facilities on campus for them to do so. We connect with housing, and we have a whole student case reporting team, and we work together to make sure that it's seamless, that students who either self-report symptoms and are evaluated and tested, or students who, for instance, have already had testing and are reporting a positive test result to us. We also are tracking those students and reaching out to them, making sure that they have a symptom log in order to monitor their symptoms, check their temperatures. Students should know if they have any of the severe symptoms of COVID-19, if they're having chest pain or unrelenting chest pain, shortness of breath, new confusion, or difficulty arousing. That's a 911 moment. They need to seek emergency services at that time. We have had 3 positives, and we've tested several students since last week that have presented to us. And we've had 3 positive on campus, and some have elected to return home for care and support and TLC that they can't get necessarily on the campus from their loved ones at home. Others have elected to stay on campus to isolate and quarantine. The housing, Residence Life and Housing has done a beautiful job of just making sure students have their needs met, they have the essentials, that they have toiletries and linens and food. Plenty of food is what I'm hearing from students, so that's a good thing. And then we're checking on them routinely to make sure that they are doing okay. And once they have completed, say, if it's a positive test, a 10-day, 24-hour period, and they're 24 hours free of fever, then we would medically clear them and simply give them a statement that they're okay to resume classes, much like we would if they were in for influenza or some other contagious illness like, say, pink eye. We just give them a clearance statement that allows them to resume in-person classes if they have in-person classes.
Great, thank you for that. Great information around that. Dr. Griffin, you're a professor, college professor, and so many things have been happening in terms of modality shifting, online, hybrid courses, you name it. I'm wondering how all of this has impacted your teaching as well as your research.
Great question. it has certainly been a time of transition. And so since March, of course, when we made that emergency transition to continue to meet the needs of our students by transitioning to remote learning, it was a bit overwhelming at first, but I think there was so much support and effort put into it as a collective. The students were, willing to continue to engage and still trying to manage their anxieties about what the remainder of the semester would look like. Faculty, we all pulled together within our department and across departments to share resources about how we can deliver these high quality courses via remote instruction. So I think for me personally, and sort of some of the buzz that I've heard, faculty have been very empathetic, with students and understanding the circumstances, because no one signed up for this. No one signed up for emergency remote learning. Of course, we know that there's tons of evidence about how you can implement high quality instruction online. But again, when it's done in an emergency, it's very different, right? And so there are some students, like you mentioned before, they had children. And so then their childcare now is no longer available, perhaps because they had to pull their child from daycare, whether or not that daycare closed, or whether or not they didn't feel safe for their child being in those other settings outside of the home, or if their child was a K through 12 student. The schools then, of course, those public schools transition to remote learning as well. And so thinking about how do we all manage this space and make sure we're still meeting the learning objectives, it really was about collectivism. And we really all had to kind of pull together and sort of keep that positive energy as we really channel these unprecedented waters. But it was a lot of empathy, a lot of collectivism.
Yeah, and I appreciate that. And that's the direction that we want to take, and the approach that we want to take, really in terms of reaching out to our students. I really appreciate that. Tell us very quickly about your research and your recent publication.
Sure. So I had two recent publications. One is in Urban Education. That's a journal that's focused on looking at education outcomes among students in urban populations. And that particular study was looking at social emotional learning. So some of you may have heard this buzzword, social emotional learning, and how do students develop that? How do we get kids develop these social skills and these skills to be able to cope and manage with stress? And something that my colleagues and I have found to be critically missing from this conversation is that we talk about this idea of coping, which of course is important, right? As an adult, in order to thrive, we have to know how to cope with certain life circumstances and manage the stress. But a lot of that social emotional learning literature does not discuss race. It's colorblind. And a lot of that work does not consider that Black children and youth, and of course we know as adults that we have to cope with situations related to systemic racism. And so if you think about the schooling experiences, while we would like to think about public schooling spaces as sort of these race neutral and equitable spaces, we know that they're not. And so students have to, particularly Black students in my work, they're learning how to cope and navigate these spaces that are inequitable. They're dealing with systemic racism. They're dealing with that interpersonal racism, perhaps from their teachers and peers. And so how then are we teaching them to cope with that? And so that study looked at how Black students are coping with discrimination experiences with school. And what we found is that their identity, or how they perceived their Blackness, was important in predicting their academic adjustment. So what that means, bottom line, is that, hey, if you start to build up Black kids' identity, who they are as a person, how they, their history, their culture, their heritage, much like what our role and mission is right here at a historically Black college, for instance. You can think about, we do a lot of that in our classrooms, that you're building them up, and that is going to help them cope and manage some of these experiences with discrimination, which in turn leads to more positive outcomes. And so for many of us, it might be, oh, well, that's intuitive. We know that. But again, it's about showing it empirically, right? Like how can we, again, do this in a scientific way and have these data presented so we have the science to back it as well.
Thank you. Thank you. Great work. Great work. I appreciate that. See, look, we're up against, we don't have much time left. You guys took up all the time. We're to the end. Each of you take about 60 seconds and give us your best statement about how we can remain healthy during this time. Dr. Williams, what can we do? Help me out. I need to stay healthy and safe, have a lot of energy to get through all of this. What should I be doing?
Well, you should definitely be adhering to the community standard, minding your 3 W's, distancing, physically distancing, washing your hands often, and wearing a mask. Wearing a mask makes a huge difference.
I was looking for my mask. I think
But also, taking care of yourself, making sure you're getting sleep at night. Aim for 8 hours if you can, but also eating healthfully throughout the day, staying hydrated. Vitamin C and vitamin D3 have some benefit, and zinc in terms of prevention. So just taking care of yourself in that way. And then if you have concerns, if you test positive, if you're concerned you're exposed to someone who's positive, and consider it's a pandemic, so we all are potentially exposed to someone who's positive, then please call us, schedule an appointment. If you're a student, of course, come see us. So
get my flu shot. Can I get my flu shot now?
You can come and get your flu shot.
Can I get it? Can I get it today? Can I get it now?
And you get it now? Yes, we do have. We do expect to have the flu vaccine in soon. We don't have it quite yet, but we will have it in soon.
I'll make my appointment. Dr. Tilford, 60 seconds, get us out.
Yes, so I will say again, be intentional about practicing self-care. C, create a new normal. A, think about your attitude, have a positive attitude. R is for relationships, build those great relationships, find unique ways to stay connected. And E, eat well and exercise.
I like it. Last word is yours, Dr. Griffin.
So I want to encourage you and for all of us in these perilous times to have radical hope. So channeling the ancestors, despite what they were going through, continuing to have radical hope despite what is going on around us, and channel that radical hope into some optimism that we can use to resist. So continue to have hope.
Way to take us out. That's beautiful. Thank you guys so much for joining me tonight. It has been a wonderful, wonderful discussion, and I'm sure I'll see you on campus real soon. Take care of yourselves, stay safe, be healthy, and we will see all of you next week on another edition of Future Focus Now. Good night, everybody.